Stop me if this sounds familiar. You're a professional, good at solving problems and fixing things. Your parents are getting older and need much more help than they did even 2 years ago, managing their health, medications, and the house. You want to allow them as much independence as possible, but you're running into resistance from your parents, your siblings. Increasingly, you feel out of time, out of patience, and out of ideas. What do you do? Welcome to Seniority Authority, the podcast where I track down experts to answer your questions on aging. Thanks to our show sponsor, the Riverwoods Group, Northern New England's largest family of nonprofit retirement communities, where active adults find community, purpose, and peace of mind. Visit riverwoodsgroup.org. Now, let's hear from today's guest. Welcome to Seniority Authority. I'm your host, Kathleen Toomey. Now, stop me if this sounds familiar. Actually, don't stop me. Keep listening. You're a professional, good at solving problems and fixing things. You're working hard to help your older parents stay as independent as possible. Yet increasingly, they need more help, but you can't handle all that they need and do your job and care for your own family. Where do you, the problem solver, turn to when you need help? My guest today is Dr. Jennifer Pilcher, a gerontologist and founder of Clear Guidance, a care management and dementia support practice in Boston. Dr. Pilcher received her doctorate in gerontology from UMass and has a long career working with older adults and their families, and is particularly skilled in the areas of Alzheimer's disease and related dementias. She's president of the New England Association of Aging Life Care and editor-in-chief of the Journal of Aging Life Care. Dr. Pilcher, welcome to Seniority Authority.
Thank you for having me, Kathleen. I'm honored to be here.
I'd like to start off by asking you what drew you to this industry. Those who are listening and can't see her, Dr. Pilcher is remarkably young. Why are you passionate about older adults?
Not as young as you think, Kathleen. Thank you very much. So this was really born out of personal experience for me. My grandmother was diagnosed with young onset dementia when I was a young person. And so I watched my grandfather care for my grandmother as I grew up. And it was one of those classic tragic stories where my grandfather actually predeceased my grandmother in part due to the stress of caregiving. And then we had to place my grandmother in a nursing home. And I thought to myself as a young person, there has got to be a better way to do this. There's got to be a better way to support families that are going through similar challenges. And that really has been my inspiration as I've gone forward with my career. I haven't looked back in terms of being interested in this area and delving myself really into the topic. Unfortunately, my aunt has also been diagnosed since, also at a young age, with dementia. So my family continues to have this be part of our personal story as well as this being my professional passion.
Wow. And with the growth in people living longer and the increasing numbers of folks who have dementia, there's certainly a lot of people who need your help and need your guidance.
Absolutely.
Your passion and your work in aging led you to establish a care management company. But for our listeners, can you describe what a care manager is and how do they help families? And I know this is a big question, but if you could just break it down, because I think most people have never heard of a care manager.
Absolutely. And yes, this is a big question. There's a saying out there that care management is the best kept secret in elder care. And I think part of the reason is because it can be hard to describe what a care manager does and how they can be helpful for families. So I'm going to try to give you a taste of it today. A care manager is a navigator. We have been called a personal guide through the maze of aging. Some people refer to us as consultants, coaches, advocates, quarterbacks, coordinators. hub of the wheel. We've been called all of those things. We are particularly useful in helping older and disabled adults and their caregivers find the right services and programs to relieve the burden of caregiving. We are experts in the issues adults face as they age and how those issues affect lifestyle, care, and housing. We're trained to help clients and their families understand chronic illnesses, such as diabetes, chronic obstructive pulmonary disease, heart disease, and many other chronic illnesses. Care manager can help educate the person and their family about how to manage these diseases and what to expect if there's a flare-up or exacerbation of these chronic illnesses. Another reason that care management is hard to describe in generalities is that the approach for each person varies. For a care manager's recommendations to be helpful, they have to develop a deep understanding of the person's needs, abilities, and desires. So this requires thoughtful consideration, extensive listening, and information gathering, and then coming up with solutions that are specific to each individual person. So for that reason, how a care manager can be helpful to one family may be very different than how they can be helpful to another. And I'll give you some more detail as we go along, but I think that gives you sort of an overview here of what we're talking about.
I think that is very, very helpful. One thing that I've noticed as I've, started talking to people with this podcast and just in the years I've been in this industry is that aging has really changed. People are living longer. There are different solutions now. How long has the actual practice of a care manager been around? How long has the actual practice of a care manager been around? And how does it differ from what individual or doctor does? I think our parents' generation, just you had a doctor or a nurse, you didn't have a care manager. So is this a new evolution?
It's actually not new at all, Kathleen. It was founded in the 1980s by a group of social workers in New York City who came together noticing that there were gaps in the medical system and that people were having trouble navigating through the system of healthcare and elder care and caring for their parents. At that time, the Visiting Nurse Association had quite a robust program, but many folks were saying, I would really like to continue with my social worker or continue with my nurse after the insurance stopped paying for those kinds of services. And that's how this sort of practice was born out of that. It's developed a lot over the years. And I think in terms of what a doctor does or a nurse might do in a medical practice, their job is really to look at diagnosing and treating certain illnesses. The job of a care manager is to help you follow up on what are the appointments that you need to have? What are the specialists you need to see? What lab work do you need? What tests need to be run? What medication changes are being made by the doctor? And then we become partners with the medical doctor to communicate to them if we're seeing any side effects or new issues or things that are coming up. Our whole goal as care managers is to keep people out of the hospital and out of crisis situations. Doctors like that, so we're often partnering with them, but it doesn't replace what a doctor would do. It's a supplement.
Well, and it makes sense when you think about how many doctors and specialists we all have as we get older. It's not just following one doctor's guidelines, it's following 3 or 4 or 5. And you're right in that how a person continues the follow-up and the medication management is really important toward their continued health.
Absolutely. So, just to add to that, Kathleen, I would say that, when our elders now, when they were receiving medical care in their younger years, the model was that the primary care really managed all of those different specialists and communicated with all those different specialists. The truth is that's just not the case anymore. It's up to you as the patient to make sure all of your specialists know what the others are doing and what they're prescribing. And that can be overwhelming if you're someone who's looking at a medication list that's 20 or 25 different medications long. that's one of the ways that we can be really helpful.
Now, who would typically hire a care manager? Would it be a spouse, an adult child, a solo ager, someone who is older and on their own? My assumption would be it's someone other than the person receiving the care, but that could be wrong.
Most of the time, it is a family member or a friend even, or someone who's responsible for an older person, such as an attorney or a guardian, that might be asking for the services. But we certainly have older folks that come to us, solo agers, as you referred to them, who do hire us themselves. These are particularly fantastic individuals because they're ones that are thinking ahead about what's coming, wanting to be mindful, and wanting to be sure that their wishes are being met as they age. So with the boomer generation, we are seeing more people try to take control of their aging in their 70s when hopefully they're still healthy and able. And so we are seeing more and more solo agers that are coming to us and engaging with us individually. But most often it's an interested party or a responsible party, whether that's a family member of all different kinds. Even have, sadly, some parents that are coming to us for their disabled child or a child with younger onset dementia or cognitive impairment.
Yeah, I know a number of adults who are dealing with their adult children who have developmental delays and trying to make a plan for them. And that is such a hard situation. What is the trigger to hire a care manager? Are you used to getting calls from people who are, all of a sudden some event happened and so they need a care manager right away? I would assume they call you when they're in trouble and they need help.
Well, yes, I would say there's still a large amount of that. Probably about 50% of the calls we get are folks that are in a crisis or an urgent situation with a parent and are unsure how to proceed. But I would say if I had to generalize, what I would say is it's usually a difficult issue around aging, okay? So care managers are really well-versed in issues that affect behavior and cognition. So that's really important as well to know. So we deal with things like dementia, Parkinson's disease, mental health challenges, multiple medical issues. So it's usually one of those where a family is experiencing a challenge related to something like that, and they're reaching out to say, I'm unsure what to do next. Interestingly, and I think you would find this across the board, it's certainly true in our practice, and I'm sure it's true for most practices across the country, resistance to support is often the biggest reason that we're getting called, no matter what the challenge is, right? So you could have none of those disease processes going on, but you have a parent that's really resistant to accepting any kind of change or support as they age, and their children or their family members are concerned about that. And so that is most often, I would say, the trigger that inspires people to ask around, who do you talk to, about this challenge?
So you folks who are care managers know how to work on resistance, eh? That's a tall order for a lot of folks.
It sure is. But I think, we've had a lot of experience as care managers thinking about how do we communicate with older adults? What are the best ways to present these ideas? And don't forget that a care manager has a specific value in being a neutral, objective party. Mm-hmm. So we're not emotionally involved in this. So we're able to see it differently and to have conversations with older adults differently about their future. And that can be something that's really challenging for family members.
Absolutely. I think that having a dispassionate professional is a good way to open up the conversation. You don't bring all the baggage of childhood or if you're a spouse or something else. So you have that trust factor there. What kind of background should someone look for when they choose a care manager? Do you want somebody with a social work background, with a nursing background? How do you decide?
Yeah, it's a great question. I think it really depends on what your needs are. So many nurse care managers are able to do things like medication management. So going into the home, figuring out a system for managing the medications, overseeing the medications, working with the doctors on medication changes, refills, all of that kind of thing. So in that case, a nurse would be particularly helpful. There are also folks that have really chronic diseases that they're trying to avoid exacerbation. So CHF or COPD are two of the ones that tend to sort of have an exacerbation and then resolve. And often having a nurse involved in that can detect those beginning stages of an exacerbation would be helpful. But social workers have gotten very good at this as well over the years, as well as, if you're looking at family dynamics and needing to work through issues like that or coordination of care, a social worker can be really helpful to you. I think the most important point is you're really looking for someone who is at a master's level of education here, because there's a lot that goes into understanding all of these systems, how they work together, and the expertise to want to work with the families that are really struggling with these challenges. You also want to look for someone who's had experience in other areas of elder care so that they're really understanding what's the difference between assisted living and nursing home and memory care and independent living. And how do I know what's right for my individual family member? So I think it really depends on what your need is, but you're really looking for the experience and the expertise that person might have, particularly if you have a disease, a specific disease you're dealing with. You want to know that the person you're hiring is going to have expertise in dealing with that disease and what comes with it.
That is really helpful. So master's level, and if it's hiring for someone with an older adult, they have to have experience in that field for a number of years. Our listeners are all over the country at this point, which I'm really thrilled to share. So some are New England, Chicago, California. Not everyone can come to Boston and go to Clear Guidance. Where would people go to find a care manager?
Absolutely. So there's a website, which is www.aginglifecare.org. And right when you get on the page, there's a big box that says find a care manager. So you can click right on that and put in your zip code, and it will show you the people that are available in your area. So that's one way to do it, is to search online. The other way to do it is also on that website. You will see that there are presidents of the different chapters around the country, and you can get in touch with the president of that chapter and ask if they have a recommendation of someone that's in your local area. I always think it's best to get a personal referral. So you can ask your doctor. If you're attached to the Alzheimer's Association, you can ask them for a recommendation. Any of those agencies that you might be involved with that know care managers in your area. And if all else fails, if you find a care manager that you're not familiar with or someone else isn't familiar with, ask the care manager for references. Ask them to give you people to talk to that they've worked with in the past that had similar struggles, so that you can get right from the source what the experience was of working with that person. And I would talk to 2 or 3 people to make sure that you found not just the person with the expertise, but the person that you feel like is going to work with you the best and you have the best connection with.
Yeah, I think it's a very important fit. So that's a great recommendation, aginglifecare.org. Is there an accreditation or any kind of accreditation or certification that you should look for when choosing a care manager?
Yes. So on the website, aginglifecare.org, when you go to find a care manager, people have different levels of membership depending on how much training they've had. For example, I am an advanced professional, and then there are professionals, and then there are associates, I believe. And all of it has to do with number one, number of years in the field, and number two, whether you're certified or not. So there are a number of certifications that are out there that a care manager can have, but only the advanced professionals on that website are the ones with that certification. So that's what you want to look for on the website, is looking for someone who's an advanced professional in the field.
Great. Tell us about the certifications. What kinds of certifications are there?
So the one that is most significantly attached to care management and the Aging Life Care Association is through NACM, NACCM, and the label for that is CMC, but there are several.
Okay.
And so what you can do is go onto the website and it lists all of the certifications that are accepted by the association.
By aginglifecare.org. Okay.
Yep.
All right. That's terrific. And how long is a typical engagement with a care manager?
Yeah, that it does depend. Let me give you some examples of what that could look like when you engage a care manager. So certainly care managers are available to do one-time assessment and recommendations. So meeting your family member and making recommendations to you. Often that involves some investigative work where a care manager is calling maybe multiple family members, medical providers, anybody else that's involved with that family member to really get a holistic picture of what this person's needs are, and then making recommendations to you as a family. So it can be one-time assessment and recommendations. Another way that we work with families a lot is through coaching. So this could be intermittent consultation and coaching with the care manager as situations arise.
Mm-hmm.
This works well for families that are very involved in the care of their family member, but find themselves struggling with things they're not sure how to handle. So a care manager can be a coach in that regard, helping them work through problems as they come up.
If you're getting smarter, help us reach more minds. Leave us a rating and review on Apple Podcasts. Tell your friends to follow us on social or subscribe to our newsletter at seniorityauthority.org.
Also, a care manager could be used in complex family systems where there are lots of family members that need to be guided or coordinated through a decision-making process or a discussion about what level of care is necessary. This often happens with families when we're talking about, should mom be cared for at home or in a facility? What does that look like? How do we make that decision? So the care manager can be a coordinator and a mediator of those discussions. And lastly, there is the opportunity to have the care manager work really hands-on, not just making the recommendations, but implementing those recommendations, monitoring the care your family member is getting, and continuing to assess and recommend over periods of time. So there's a range of ways to engage with a care manager. And when you call and talk to a care manager, you want to talk about that very thing. What is it that you envision is useful for you, is valuable to you? And then also to ask the care manager from their perspective, what do they see they could do that would be helpful? Because there may be things you haven't thought of that a care manager could do to be helpful that would actually be really valuable in your situation.
Sure. And so it sounds like it really depends on the relationship that you have with your parent or a loved one and how complex the family is and how aligned the family is. Because I would imagine if everyone agrees this is the way we're going to go, it's a little easier than if some people feel we're going to go right, others feel they're going to go left. That's going to require more mediation and navigation.
You got it.
Yeah.
Absolutely. But I think it also has to do with distance. Sometimes families are much more involved, but they're at a distance, so they can't. It also has to do with work or family obligations. You know, there are family members that would love to be able to be at mom's house, you know, every evening at 4:00 to make sure she took her meds. but, they work full time and they've got small children or grandchildren. And so they can't be there to do that. So, that also factors into how you might think about using a care manager. One of the things I think is really important to emphasize here is that in the past, I think there was an idea that you only needed a care manager if you really needed somebody to be hands-on managing everything. And I think that shifted in the field a lot, especially through the pandemic, but even before that, in saying care managers can be useful to you in shorter term or in an intermittent way, as opposed to having to be hands-on all the time. And it also opens it up to being available financially for people. Rather than having to think about a big financial commitment, they can think about the consulting end of it.
Developing a relationship early on with a care manager that you can then establish, here's the situation, here's where we are, here's step one. And then when things change or shift, you go back to the same care manager and say, you know what, challenges have increased. Then you're not starting it all over in the midst of a crisis.
Right. Not only that, Kathleen, but I think the job of a care manager is to say, okay, here's where you are now. Things are stable. This is great. Here are the red flags I want you to be looking for over the next few months or years. And when you see this red flag, that's a good time to get back in touch with me and we can work through it.
Yeah, I think that is really smart because we would all love to put a plan in place and then it never changes. But unfortunately, that doesn't happen. You've got change.
We can count on is change. That's
constantly. One thing that I'm curious about is how does a care manager collect all this information with all of the HIPAA restrictions? Do they sign an agreement? Like, how do they access all those files so quickly?
Great question, Kathleen. Yes, that's a big issue. Confidentiality is a huge issue. So care managers are required. You have a work agreement with a care manager that includes a confidentiality statement. You also sign HIPAA release forms for that particular care manager to talk with your individual providers. And most providers have heard of us or want to work with us, so it's not an issue. Usually, sometimes you'll have to sign a HIPAA release that's specific to that medical office. But the care manager themselves has a HIPAA release form that you sign, and usually 9 times out of 10, that works just fine. It is really important that you know how the care manager stores their information about you and how it's protected, because that's really important. But every care manager should have a system for doing that so that you make sure your information is staying confidential between you and the care manager. And it's important to know that you as the client are driving who you want that care manager to talk to and what information you want them to have. Obviously, a care manager can do the best job with the most information, but you're the driver as the client or the client representative, and it's your choice how those things work.
I think that a care manager sounds like a great strategy. But for those who are wondering, yeah, a care manager sounds good, but what can they literally solve for me? Do you have some examples for our listeners of here's something that a care manager can fix?
Absolutely. I've got a couple to share with you.
I always think it's good to be very practical, very literal.
Absolutely. And that is the way I run my practice too. When people call me, I want to listen to their backstory. I want to hear what's happened, what's led up to this. And then it's my job to give them very specific examples of how I can be helpful, how our team can be helpful to that family. And if you're not getting that from a conversation with a care manager, call another one. Because they really need to be able to give you specific examples about what they would do to be helpful. So I'll just give you a couple of scenarios that I think capture some of the frequent challenges that we see coming across in our practice. So a frequent situation is we get called by either a spouse or an adult child. Dad has landed in the hospital. He's had multiple trips to the ER, and this time they admitted him. They want to send him to rehab. Family doesn't feel like he's ready to go to rehab, doesn't feel like issues have been resolved. And there are a series of questions that come up, right? So the hospital may be saying to the family, you need to pick a rehab. Here's a list. Pick one off this list and we're going to go there. And the family has no idea the difference between this one or that one, except for the location, right? How do I know that I'm sending my parent to a quality program? What if I don't feel like they're ready to be discharged? What are my rights? What can I do about it? And there actually are things you can do. There's an appeals process. There's work that can be done with the discharge planner. We also need to know what kind of rehab your parent is going to. There's acute rehab. There's subacute rehab. What's the prognosis? How long do we think they're going to be in this situation? Should they go home rather than going to rehab and go home with services? This is something we worked on a lot in COVID because people didn't want to go to rehab at that point. And what are the good programs in the area? And then what's the next step after that? Often people think, okay, rehab, good. We've got, 2 months to decide what the next step is. The truth is you might have 2 weeks and you need to start thinking about how are we going to get dad home after that? What services do we need in place? How do we need to think about that? So this is a really good example of the fact that there is this maze of services for older adults, and they're all siloed. They don't necessarily work together. So ER's job is to stabilize you and either admit you to the hospital or get you back home, right? So they're not going to look holistically. So there's advocacy that needs to happen to get them admitted. And then once they're admitted, where do we go from there? And how do we know we're making the right steps or this is the right time? That's where a care manager can step in and be helpful. Obviously, the sooner you call a care manager, the better advice you're going to get. So the time to call the care manager is when your parent hits the hospital, not when they tell you you have 48 hours to make a decision. We get those calls a lot too, and we can help. But the sooner you engage, the better off you'll be. So that's one example. I think another example is when you're dealing with a particular challenge. So I'm going to give you an example from our practice as we specialize in working with people with dementia and cognitive impairment. So we've gotten calls from caregivers who are saying, I simply cannot get my loved one in the shower. They just will not take a shower. And I can't figure out why this is happening. Why won't they take a shower? And so we're able to go out and work with the family on this issue. What are they doing environmentally to set up the shower? How are they aging? How are they communicating? How is this working? And help the family come to a solution to make bathing easier. So that's just a really practical example of how a care manager can come in and help with a really specific issue they're having. And for that family, for many families, once we resolve that issue, they're relieved and they can go on caring for their family member for quite a while, but then it may come up again. So that's the second example. The third example I'll give you is sometimes there are issues with whether or not an older person is able to continue making their own decisions. And how do I know if this person is able to make their own decisions? Because older adults are allowed to make bad decisions. Just like
Absolutely.
Right? So how do you know as an adult child who feels responsible for the safety of their parent, should I allow them to make this decision I don't agree with? Or is it really dangerous and do I need to do something else to intervene? That's where a care manager can step in to help look at the situation from an objective point of view and help you really figure out, what you need to do in that situation and how to address it. So those are sort of 3 examples of different ways that care managers work and how they can be helpful.
Those are terrific examples because I think it always helps to say, I see myself in this situation, or I see how I could use a care manager in this situation. And the other myth or question that I have is, are care managers, how are they bound in terms of their need to do what's right for the patient, or the older adult? So I could see where you would get into a conflict. Can this older adult stay home, or do they need to go somewhere else? And how does a care manager resolve if they see a situation that they think is unsafe, or at what point do they need to advocate against perhaps the person who's hiring them for the person that does that come up at all?
Very tricky what you're talking
Yeah.
about. Right. If the person, so the client in care management, the client is always the older adult. So regardless of who pays the care manager, regardless of who signed the work agreement, it is always about what's right for the client. And we have a series of standards and ethics as being members of the Aging Life Care Association. And I think knowing one of the reasons that I directed you to the website is you want to work with people that are members because they have to uphold themselves to those standards and ethics of practice. And those are listed on the website as well if you're interested in knowing what those are. But the bottom line is it always has to be in the best interest of the older adult or the client. And sometimes that comes in conflict with what an adult child wants or what another family member wants. And so it's our job as care managers to work that out. When I'm training care managers, I always say, you never want to be on an island. A care manager is not supposed to be the only voice in the room. The care manager is supposed to bring together all of the other resources that surround that client to help make that decision. So good decisions should be made with physicians and attorneys and financial planners and wealth managers, right? And social workers and PTs and OTs. It's the care manager's job to bring in the experts to help inform the decision. And so often the care manager is either providing choices, saying this choice would be appropriate and safe, and this choice would be appropriate and safe. Or the care manager is saying there's really only one option. When I look at all of this information from all of these people, there really is only one option that's safe and appropriate.
Okay.
And it's their job. It's the job of the care manager to give you an opinion. It's not the same as having a case manager in a hospital or something like that, who their job is just to give you resources. A care manager is supposed to give you resources and give you their well-informed opinion. The opinion has to be based on information from lots of different sources. Hopefully that answers your...
That is a great answer. And I think that is huge and probably something I should have answered earlier or asked earlier, but I think it's really important to understand you are ethically bound to do what's right and to try to do this in collaboration with all the other people in the room. When you think of wealth managers and attorneys and children and, doctors and it's a lot. It's a lot to manage. Because it's a lot to manage, I guess my final question is there a way to set up a care manager for success, in your opinion? I'm sure you have a lot of examples as to how not to do it. So do you have any suggestions as to how can you engage with this person and make it as successful as possible?
Right. So I think there's two parts to my answer. The first part of my answer is you need to be as open and honest with the care manager as you possibly can be, not just about what the current struggles are, but the history and what's led up to the situation, what your family dynamics are. The more that the care manager knows about all of those different pieces, the better help they can be to you and your family. And I know that can be hard when you're engaging with a person you don't know, but trust that this is a person that has heard a lot of different stories. You're probably not going to shock a care manager. And the more transparency you can have, the better recommendations you will get. So I would say that's the first thing in setting up a good relationship with a care manager. The second thing is you need to be clear about what your expectations are. How much of the situation do you want to manage, and how much of the situation do you want the care manager to manage? And be open and listen to the ideas of the care manager about that balance, what they could be doing to relieve some of your burden of caregiving. And you have the right to change your mind. So just decide you want to work with a care manager in one way. When you begin, you can always change your mind and either ask them to do more or ask them to do less over time. It's a very flexible relationship. And I think the last part of that is to be clear about how you want to communicate. What's the best way to communicate? Do you like phone calls? Do you like emails? Do you like text message? What's the best time of day for you to get information? How do you like to get information? Is it best for your family to have a group email or a conference call or a Zoom call, right?
Mm-hmm.
What's best for you? And then the care manager knows what those expectations are and those preferences, and they can help to make that happen for you so that you can feel as informed as possible about what's going on with your loved one.
That's great advice. That just makes a lot of sense. Anything I did not ask you that you think our listeners should know about or think about when they are considering care manager?
Yeah, I mean, I think that the most important thing to know about a care manager is that you might think, I don't need that. It's too soon. And the most important thing I would say is call and explore it. Get a recommendation, find someone in your area, explain your situation, and have them give you examples of what they might do to be helpful. It might surprise you how it might be helpful now or in the future, but at least then you have an idea of what that looks like. And if you find yourself in an urgent situation or in a jam, you've at least had a conversation with someone ahead of time. And there are lots of different, very, very qualified and exceptional care managers across the country that care a lot about working with families. So please reach out and find out what a care manager can do for you and your family.
Well, thank you so much, Dr. Pilcher. I think you did a fantastic job just introducing all of us to the idea of a care manager and to the idea that you're not alone out there as you're trying to figure out these solutions. And part of this podcast is to try to help you open up your mind and say, there are more places I can go to for answers. And this is a very big one we just covered today. Clear guidance and the other website that Jennifer mentioned are going to be in the show notes. So check out the show notes if you'd like to. If you heard them but didn't hear them again, it'll be there. And feel free, again, to post questions if you have follow-up questions. You may get Dr. Pilcher back here. Thank you so much for being here today. I know I learned a lot, and I think everyone else did too.
Thank you, Kathleen.
That's our show for today. If you enjoyed it, don't forget to tell your friends about it so we can grow our tribe. Visit our website, seniorityauthority.org, to submit questions for future shows or for Dr. Pilcher, and watch archived episodes. Give us a rating on your favorite podcast platform and visit us on social media. Until next time, enjoy the chance to get smarter about growing older. Thanks. Thanks to our show sponsor, the Riverwoods Group, Northern New England's largest family of nonprofit retirement communities, where active adults find community, purpose, and peace of mind. Visit riverwoodsgroup.org. That's our show for today. Did it spark a question? If so, send us your questions at seniorityauthority.org and we'll track down the answer. Meanwhile, don't forget to subscribe, like us on Facebook, follow us on YouTube, and rate us on your favorite podcast platform. Until next time, let's get smarter about growing older.